Let me say good afternoon, and let me thank everyone for joining us today. I want to welcome Dr. Mark Callender, the president of Memorial Hermann Hospital, who is with us today, and he'll be speaking immediately after myself. And then Dr. David Persse, the chief medical officer for the city of Houston, Chief Pena with the fire department, David Martin, the mayor pro tem, and Carlos Cisneros, the council member of District H. As we get closer to Thanksgiving Day and the holiday season, and people start to think about Christmas, Hanukkah, and other holiday celebrations, we think it is important to use our collective voices and send a clear message about the health and safety of people in our city. We want to provide some additional guidance on how you can protect yourself and your loved ones and friends from the COVID-19 virus. And let me just say, we've been having these conversations for the last 8 months. We've gone through one phase, and then as you know, what took place over June, July, and August, how the numbers really increased. Positivity rate was very, very high. Then the numbers started coming down in September, October, and now we're seeing a resurgence all across the country, even in West Texas, and we want to do everything possible to keep this virus in a manageable state in the city of Houston, and certainly until such time as vaccines become available. And the reason being is that the Houston positivity rate continues to creep up. 5 weeks ago, the positivity rate, we had gotten it down to 5%. The goal really was to crush it, to get it below 5%. Then the numbers started to creep up. So we've gone from 5.6 to 6.5, 6.7, 6.9. Today, the positivity rate for this week is now 7.9. So you see, we are moving in the wrong direction, in the opposite direction that we intend. The increasing positivity rate, the daily new cases, and the hospitalizations are clearly a dangerous trend in the wrong direction, and we want to reverse course. Today, the Houston Health Department is reporting 141 new cases of COVID-19, bringing Houston's total to 90,239. There are 2 newly reported deaths, bringing the city's total to 1,398. The 2 newly reported deaths are on your screen, and they include a Hispanic male between the ages of 50 and 59, and a Hispanic male between the ages of 60 and 69, both with underlying health conditions. As the holidays approach, traditional large gatherings with extended family members and friends are simply not safe at all this year. I want to repeat that as we approach the holiday season. Thanksgiving is right upon us. These traditional gatherings where we invite people into our homes, we have large gatherings, friends, you name it, it's not the way to proceed. This year, we want that message to be loud and clear. This virus thrives on gatherings and will take advantage of holiday festivities to sicken our loved ones and further spread within our community. We strongly urge, in a very respectful manner, we strongly urge everyone to limit in-person holiday gatherings to household members only, to slow the spread of COVID-19. People who attend a holiday gathering with people who don't live in their home need to consider avoiding non-household members for 14 days before and after the event. And although the holidays will look and feel different this year, making smart choices could save the lives of the people you deeply love. Use caution when it comes to holiday travel. And I want to underscore this because we know during the holiday season, just before Thanksgiving, a lot of people traditionally will travel from one location to another. I want to encourage you to avoid going into areas with high community spread, in other parts of the country, even in West Texas. And I want you to be mindful that people, your guests, your relatives, for example, who may travel from other parts of the country where the outbreak is pretty much running rampant, far greater than what exists in our city. If they are coming from those areas into the city of Houston, into your home, that simply would not be advisable right now. And then I want to caution Houstonians who are thinking about traveling outside of the city of Houston to areas where the virus is rampantly spreading, much, much higher than what exists in the city of Houston, and then you plan to return. This year, and especially at this time, I certainly would caution you in making those travel arrangements and encouraging others from outside of the city to be coming into the city, into your home. But the understanding is clear, and what we do know is that the wearing of masks do work. They do work. And when 95, let's say, % of the people in our city, when they are wearing these masks, they do work. And they prevent, mitigate the spread of this virus to someone else, of the virus coming from someone else to you. As a result, the wearing of masks in Houston is mandatory. And let me underscore that. The wearing of masks in the city of Houston is mandatory. And if after getting an initial warning, you are subject to a $250 fine. So let me underscore it. Nobody wants to give you a citation. No one wants to fine you. But the wearing of masks in the city of Houston is mandatory. And I would ask you to please comply with that. We prefer to warn people only, but we are at the point that we need to be more forceful in our messages and help people to understand the danger in which they are putting themselves and everyone else in this city when they do not wear a mask. Out of concern and an abundance of caution, we made the decision to reimagine the city's Thanksgiving Day celebration this year. Every year, the HEB Thanksgiving Day draws thousands of people downtown for the Thanksgiving Day parade. But this year, it could become a super spreader event, and we do not want this holiday parade to contribute to the spread of the virus. And due to COVID-19, the mayor's office, along with HEB and other sponsors, will instead host the HEB Family Thanksgiving Food Distribution. So instead of the parade, it will be the HEB Family Thanksgiving Food Distribution. It will take place this Saturday, November 21st, from 8 a.m. to 2 p.m. At the NRG. And it will be from 8 to 2 or until the turkey and the ham and all the other supplies run out. The distribution will include groceries for preparing your own Thanksgiving feast. And so we will encourage families who find themselves in need to come out to the HEB Family Thanksgiving Food Distribution this coming Saturday from 8 to 2 or until food runs out. I know it's difficult to celebrate without all of our family and friends, but we must stop this virus. Quite frankly, we must blunt the positivity rate, the increase, and start working to bring that down. And we need everyone's help. I'll close with this. Remember, don't invite COVID for Thanksgiving dinner, okay? You want the turkey, the ham, all of the trimmings. But what you don't want is to invite COVID to your Thanksgiving dinner. So leave COVID on the outside. And in so doing, we will all live to enjoy another day and another year. Having said that, let me now pause and bring up Dr. Callender for his remarks.
Well, thank you, Mr. Mayor. And I join with healthcare providers from across this city and across this region asking that we all abide by the mayor's recommendations, these guidelines that have been established, and that we know can help us limit even stop the spread of this terrible disease. Now, we know we're at a time of higher risk, just related to the weather being cooler. We tend to spend more time indoors, and so that puts us at higher risk for transmitting and getting the infection. If we follow these guidelines, the 3 W's, wearing masks, washing our hands, and watching our distances, we can markedly reduce the risk and stop COVID-19. Now, as the mayor suggested, we can celebrate our holidays safely. Certainly the safest way is to celebrate in our own homes with members of our own household, but we also can be creative. We can use these marvelous technologies that are available to us now to celebrate virtually with members of our family outside of our household and friends. We can talk about the things that we're thankful for. We can talk about our friendships, our relationships. And if we do come together, we encourage that we do that in groups at 10 or smaller in number, and to the extent that it's possible, do so outside and use the 3 W's to protect ourselves. We all have been through a period of time here when we saw the very negative impact of having high numbers of COVID-19 cases. We saw the impact, the negative impact on health and well-being. We saw the negative economic impact that still is affecting our city and our region. We can avoid that. We can stop this surge which seems to be building if we follow the mayor's advice and abide by the 3 W's. Thank you.
Thank you, Dr. Callender. Now let me call on Dr. Persse.
Thank you, Mayor. Thank you, Dr. Callender, for coming and joining us today. When we look at the cases in Houston, and I think we got a graph we're going to bring up. We've noticed that in July we had a pretty high surge. And you've been seeing on the news that we've been hearing about how the numbers have been trending across the state. So this graph shows the numbers of COVID cases here in Houston. And I want to draw your attention to 2 things. First of all, if you look at how high that spike was in July, and let us remember the impact that that had on the economy and the hospitals. And the hospitals had high percentages of people who were admitted to the hospital at that time with COVID disease, which you have to remember, heart attacks, new births, other illnesses continue to occur. Health continues to occur, and people need those hospital beds. So it put a real bind on the hospitals, but it wasn't just the folks with COVID in the hospital that we need to think about. It's everyone else. Because hospitals don't run with 50% occupancy. They run pretty full all year long, right? So we did a great job, and look at how steep that curve goes down. And we were able to get it down very low in September and through October. But here in November, if you look to the right side of that graph, you'll see that those numbers are starting to creep up just as we are entering the holiday season. And all the things both the mayor and Dr. Callender said about family gatherings will make that a potential bad combination. And I want to get back to the hospitals, because remember, we're hearing a lot of folks talk about how it's younger people who are becoming ill and they don't require hospitals, and that's true. The other thing that's happened is the hospitals and the physicians and nurses have gained skill and expertise in taking care of hospitalized COVID patients, and we're doing better and better with that. But if you look at this graph here, this shows for our region the percent of hospitalized patients who are experiencing COVID and are diagnosed with COVID disease, and you'll see it's at 8.8%. And I will tell you, whether it's on the screen, that I know that just 6 days ago, it was about 6.4%. So the graph to the blue and red lines on the bottom there, the scale makes it difficult to appreciate, but the numbers of hospitalized patients are starting to creep up again. But again, I want to remind folks, we crushed this virus, well, we nearly crushed it. We pushed this virus way down and into a corner once before, in fact, twice before, but we certainly can do it again. And then finally, in the last slide, this is what's going on across the state. And with that blue chart, you'll see this is the hospitalizations across the state. And you can see that peak back about 4 or 5 months ago, but you'll also see how the numbers on the right side are going up. And I want you to think about the graph that we just showed you of Houston, which is dramatically different because our curve looks nowhere near as bad as this curve. So that means that we have time. We've got the experience. We know what to do. We've done it before. This community has done it before. Follow the advice that's been given. Wear the mask. Wash your hands. Avoid large gatherings. And then one other thing I want to remind people, a really important part of our strategy to protect ourselves is that for those folks who are ill or who have tested positive, you need to isolate. And we recognize that that is hard to do, especially if you don't feel terribly ill. But isolation means you stay away from other folks, and it's predominantly your family members. No, you don't go to work. And no, you stay in your room at home and you have your meals brought to you until 10 days passes and you've not had fever for over 24 hours and your other symptoms are improving. Or if you're a family member who needs to be in quarantine, you actually have to quarantine. Because remember, 40% of people who are infected have no symptoms, and so they don't feel badly, and so they could be unknowingly infected and spreading the virus to even more folks if they go to work, if they go to church, if they go to the grocery store, if they go to any place where they could come across and be close to other people. So isolation and quarantine, especially for those who don't feel terribly sick or have no symptoms at all, yes, it's difficult. But those are the sorts of things that we in this community need to double down and do so that we can repeat our excellent performance a couple months ago and drive these numbers back down so that we protect our family members. Remember, the person you're most likely to infect is a member of your own family. So when you follow these rules, you're protecting your family, number one, and the community needs that help too. Mayor, thank you.
Thank you, Dr. Persse. Let me call on Chief Pinion. I'm going to ask him to give his report in English and also to provide the additional comments in Spanish.
Thank you, Mayor. Thank you, Doctor. Thank you and your team for being here and joining us today. Really quickly, I'm gonna run down the fire department's numbers, and then I will relay the mayor's message in Spanish. So for the fire department today, our numbers have been following the trends like the city has. They're going up a little bit. 2 weeks ago, we were at 60 firefighters in quarantine. Today, we are at 100 firefighters in quarantine. We have 30 currently that have tested positive for coronavirus. In total, we've had 317 that have tested positive. 287 of those have returned to work. We don't have any firefighters that are in the hospital at this moment, and we hope to keep it that way. We are continuing to provide our firefighters with the equipment and the tools that they need to safely serve this community. En español les voy a pasar el mensaje que dio el alcalde Turner acerca del número de coronavirus en esta comunidad y las recomendaciones que les estamos dando a nuestra comunidad para asegurar su seguridad en estos tiempos de acción de fiesta y esta temporada navideña. Debido al número de casos que tenemos en esta ciudad del coronavirus, que está aumentando, lo que nosotros recomendamos es que en estos días, en esta temporada navideña, en estos días de acción de gracia, que limiten el número de personas que estén en su casa a un grupo chico, ¿sí? Si pueden limitar las personas, nomás los familiares más cercanos, para poder evitar la transmisión del coronavirus. Nosotros sabemos que en grupos grandes el virus puede pasar de una persona a otra fácilmente, y queremos evitar que los números de coronavirus sigan aumentando en esta comunidad. Hoy está el número de personas positivas acerca del coronavirus en la comunidad, en la ciudad de Houston, en el 7.9%. Eso ha aumentado en septiembre, que estábamos un poco abajo del 5% en esta comunidad, y ha aumentado casi 3 puntos en este mes y medio. Ha habido también 2 muertes hoy que se reportan nuevas. Fueron 2 personas hispanas, uno en sus años 50 y otro de 60 años más o menos. Esto sube el total de muertes en la ciudad de Houston a 1,398 muertes que han ocurrido desde que empezó esta pandemia. El segundo mensaje que quiere pasar el alcalde Turner es que si van a viajar en otros lugares aquí en Texas o en otras partes del país, que tengan precaución. La recomendación es que si no tienen que viajar, que se mantengan en casa, y si esperan familiares, también que tengan precaución, porque especialmente si vienen de otras partes donde están los números de coronavirus más altos, en el oeste de Texas, en otras partes del país, que están los números elevados, que tengan mucha precaución y que no inviten al coronavirus a su cena de acción de gracias. Este año no va a haber el desfile de acción de gracias, por también precaución de no tener grupos grandes. Lo que se va a hacer entonces va a ser una distribución de comida, de todos los preparativos para una cena de acción de gracias, y eso va a ser el sábado en el NRG, sábado 21 de noviembre, de las 8 a las 2 de la tarde, hasta que duren la comida. Van a dar pavo y todo lo que se requiere para poder preparar una cena de acción de gracias. Y quiero repetir, eso va a ocurrir este sábado, el 21 de noviembre, de las horas de las 8 de la mañana hasta las 2 de la tarde. Thank you.
Thank you, Chief. And then just two additional things. Number one, there are plenty of testing sites throughout the city of Houston. No cost, no charge. Please, please get tested, okay? So if you got tested, for example, a month ago, it's time to get tested again. If you've been around large gatherings, especially around people who didn't have their masks on, it's time to get tested. So please get tested. Do that for yourself and for your family members. The second thing, bear in mind, flu season, so please get your flu shot, okay? You don't want to compound the two, so please get your flu shot, and then and at the same time, get tested. If you do those two things, then that will help us out as well.